From CBS 4, this is Aging Independently with Christine Bartel, empowering seniors to live on their own terms in their own homes. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Hi everybody, and welcome to our show. Pharmacists are an important, if often overlooked, member of your healthcare team, especially when you're in the hospital. Now we go behind the scenes to show you the steps they take to make sure you get the right medicine, and more importantly, keep you from getting the wrong one.
The safety process begins when they're admitted. A pharmacist collects a medication history on all patients that are going to be admitted to the hospital. The next thing we do is CPOE, which is computerized physician order entry. So our physicians enter the orders into the electronic medical record, and then our pharmacists validate that the doses and the drugs that the patient is receiving are correct. The other thing that we do is we use bedside barcoding. When a patient receives a medication in our hospital, right prior to administering the dose, the nurse will barcode the patient's wristband and the medication to ensure that patient has been ordered that medication. One other thing that we do is any patient who receives an IV intravenous dosage of any medication, first of all, that dosage is compounded in a USP 797 clean room in the pharmacy so that it's compounded under sterile conditions. The other thing is that if it is administered via an IV administration pump, we have what is considered a smart pump. The smart pump provides the nurse guardrails which make sure that she administers the dose at the correct rate and that she's actually administering the correct concentration of drug to that patient. And lastly, we use automated dispensing cabinets here. So the automated dispensing cabinet basically allows for a patient to receive only those medications that have been verified by a pharmacist.
Bill Moran, a clinical pharmacist with Exempla Good Samaritan Medical Center, joins us today. Thank you for being here.
Thanks, Christine.
So pharmacy has never really been part of the traditional team working with people, you know, on the front lines. You've always been in the background, but that's changed.
Correct. What we do at Exempla now, we have pharmacists involved from the very get-go. Before patients even come in for elective surgeries, for instance, we will call them a couple days in advance, review their medication lists with them, update them in our system so that when they come to the hospital, we know exactly what medications they take, what dosages, what frequencies, and when they had their last doses.
People don't realize how important that is, because if somebody stops taking what they were taking prior to admission, that can be a big challenge.
Exactly. We want to ensure the accuracy so that everything is exactly right in their profile in the hospital. So when they come into the hospital, they'll be taking the correct medications when they're there.
Let's talk about discharge and pharmacy.
On the discharge end as well, we're starting to expand that program where we'll be doing more discharge planning so that when patients leave the hospital, they'll know what their medications they're on. If there are changes from what they were taking previously, they'll know those. They'll understand what medications they're on and why they're on those medications and why it's important to take them.
Okay, and pharmacists are now part of that transition team. So we were used to having a medical doctor or a nurse discharge. Now the pharmacists are actually physically a part of that.
We're actually trying to expand that program now, yes. We've incorporated that on the front end with admissions, patients coming through the emergency department. Pharmacists are notified. We come into the room and talk with the patients. If they don't know their medications, and a lot of times they don't, we will call their families, we will call other pharmacies, we will call their nursing home, wherever they're from, and we'll try to get an accurate list of their medications.
This is really important because we know that one of the #1 reasons that people end up back in the hospital is medication mismanagement.
Exactly right. And so
Thank
we're
you.
getting pharmacists involved.
Yes, thank you so much for being one of those pharmacists, and Exempla, thank you too.
Thank you.
Remember, you can always go to our website for more information, to take today's poll question and learn more about aging independently by watching all of our shows. Just head to cbsdenver.com and click on Aging Independently. Be sure to join us next time for more information on staying independent in your home.
Thank you for watching Aging Independently with Christine Bartel. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Today's Aging Independently is also sponsored by Exempla Healthcare. For more information, call 303-689-4000.